Well, first off, half a day.
Half a day.
One more time. Half a day.
Half a day.
That's much better. Half a day, and welcome to the office of the governor. And we are very festive this morning to proclaim October 2024 as Breast Cancer Awareness Month. And I'm so glad to see all the pink on here at the office of the governor. I also want to take this time before we begin to recognize the presence of the Honorable Joshua F. Tenorio, our acting governor of Guam.
Good morning, everybody.
As well as the Honorable Therese M. Turlai, acting lieutenant governor of Guam and speaker of the 37th Guam legislature. Keep those applause coming from the 37th Guam legislature. We also have Senator Jesse Lujan, Senator Roy Kanata, and also former Senator Tony Ada. We also have from the Department of Public Health and Social Services, our acting director, Peter John Camacho, his deputy, Terry Uggan, our Chief Public Health Officer, Catherine Incao. From the Community Health Services Bureau of Non-Communicable Disease, we have Al Severio, our acting administrator. Guam Breast and Cervical Cancer Program, keep going. Guam Comprehensive Cancer Control Program. Tobacco Prevention and Control Program, Diabetes Prevention and Control Program, the Guam Office of Minority Health, Hypertension Prevention and Control Project, Guam Health Disparity and Community Health Worker Grant, and the REACH Project, as well as the BRFSS. Cesar Masi for joining us. I also want to acknowledge our health providers, Guam Radiology Consultants, Ray Salvador and Dr. Pichipiata Pichicheco, and Take Care FHP Health Clinic, Rose Greeno and Jerry Patricia. MGX Imaging, April Mills, our director. Community Health Centers, our Northern Regional Community Health Center and our Southern Regional Community Health Center. We saw them earlier this week. It's also Primary Care Week, so let's give them a round of applause. And the Bureau of Primary Services, Vince Uggan from the STD HIV program. We also have our community partners from the University of Guam. We have our Guam Cancer Research as well. Guam Cancer Registry, Naomi Del Mundo. We also have the Pitchy Research Education Corps and Community Outreach Corps, Angelina Murmert. We have Breast Friends Forever, Breast Cancer Support Group, Mae Bloss and Rose Clark. I love it. St. Luke's Medical Center, Phil MD Annette Garces joining us, half a day. Guam Regional Medical City, Summer Medler, Director of Cancer Center, GRMC. I see Mayor Alan Ongupta from all the way from Ilao. American Cancer Society joining us, Marisha Artero, half a day, ma'am. Guam Cancer Care, Jessica Rosales, half a day. Fresenius Kidney Care joining us. PHOA is also here in the Pacific Against Cervical Cancer Project, Serena Mariano and Leslie of Knowledge. The American Red Cross is here, Dr. Edward Telmo. Let's keep those applause coming. I swear I'm almost done. Seventh Adventist Clinic. Dave, the Susu Guam, our Zumba Mixed Fit and Hula Dance Group joining us. And Island Girl Power, Renita Blas. So it's a very long list of partners at Susan Masi for joining us. Again, what a great day to proclaim October 2024 as Breast Cancer Awareness Month. I also want to encourage you, for those of you who have colleagues or peers who couldn't join us in person, to please go to Governor's YouTube page. That's youtube.com/@GovLuGuam, and they can tune in live or watch the video later. Without further ado, I want to give the floor now to Mr. Peter John Camacho, our Acting Director for the Department of Public Health and Social Services. Peter John Camacho.
Half a day, Acting Governor Joshua Tenorio, Acting Lieutenant Governor Therese Turlai, Senators from the 37th Guam Legislature, Senator Kanata, Senator Lujan, and Senator Ada, Mayor Ngakta from the Mayor's Council, survivors, families, and caregivers, partners, other guest speakers, and all joining us today. As we gather this October for Breast Cancer Awareness Month, we unite as a community to support, educate, and inspire action against breast cancer. This disease knows no boundaries. According to the World Health Organization, breast cancer is the most common cancer globally, with approximately 2.3 million new cases every year. It represents 1 in 8 cancer cases in both genders and a quarter of all cancers in women, with a 70% mortality occurring in resource-constrained settings. It affects families, friends, and neighbors across our island, regardless of age or background. On Guam, breast cancer is the second leading cause of cancer death among women, according to the 2023 Office of Vital Statistics report. Many of us have loved ones who have faced the journey of breast cancer, and today we honor their strength, resilience, and courage. Breast cancer is not just a health issue. It is a deeply personal challenge that impacts our entire island community, our family. It is a journey of strength, uncertainty, and hope. And it is through our collective support that we can make a real difference. Early detection saves lives, and spreading awareness is essential to ensuring that everyone has access to the information and screenings they need. The Guam Department of Public Health Guam Breast and Cervical Cancer Early Detection Program continues to assist eligible women, uninsured or underinsured, with breast and cervical cancer screenings at no cost. In the past 2 years, 2022 through 2023 and 2023 through today, the program has assisted 794 women for breast cancer screening and 365 women for cervical cancer screening, as well as providing patient navigation for 872 women not eligible for the Guam Breast and Cervical Cancer Program. The program also provides coordination of referrals to treatment and education on risks and prevention through community outreach. Our island culture values the spirit of Pinafamaulik, working together for the common good. This year's theme is Empowerment Through Awareness. Let us embody this value by reaching out to our community members to educate, support, and offer hope. And remember, knowledge is power. Whether it is through encouraging our mothers, sisters, and friends to get regular checkups, participating in awareness events, or supporting ongoing research and healthcare initiatives, each of us can contribute to the fight against breast cancer. To the survivors here on our island, we are inspired by your stories of strength and determination. To those currently fighting breast cancer, please know that you are not alone. We stand with you every step of the way. And to the caregivers, healthcare workers, and advocates, we thank you for your unwavering dedication and compassion. Let us use this month as an opportunity to raise awareness, provide support, and take action so that one day, breast cancer will no longer be a threat to our families and our future. Together, as one Guam, we can make a difference. And thank you for all your support and commitment.
Jesus Masi, Peter John. Before I proceed to our next speaker, I did miss a few people. I missed Dr. Bob Leon Guerrero, Robert Leon Guerrero, Chief Medical Officer for the Department of Public Health and Social Services. I also missed former Senator Luis Muña, a champion for cancer. As well as Ms. Jane Flores, Bureau of Women's Affairs Director. Jesus Masi, for joining us. And now back to our program. I want to give the floor now to Naomi Del Mundo, Data Collection Specialist from the Guam Cancer Registry.
Hoffaday, Acting Governor, Acting Lieutenant Governor, Legislature, colleagues, and everyone. Again, I am Naomi Del Mundo with the Guam Cancer Registry at the University of Guam. I would like to thank the organizers for inviting the registry to speak about breast cancer data on Guam. During the period of 2018 to 2021, a total of 265 invasive breast cancer cases were reported. On Guam, an annual average of 66 women are diagnosed with invasive breast cancer, and 23 women are diagnosed with in situ or precancerous breast cancer. 35% of the breast cancer cases are diagnosed in women younger than 55 years old. 35% Breast cancer incidence and mortality rates are still highest among Chamorro women. An average of 7 women die from breast cancer each year in Guam. We've seen a slow but steady increase in the rate of breast cancer cases. However, they are being detected earlier. 62.5% of these cancers are diagnosed at earlier stages of in situ or localized stages, respectively, stage 0 or stage 1. This falls way ahead of the World Health Organization's Global Breast Cancer Initiative's first goal of over 60% of invasive breast cancers diagnosed at stage 1 or stage 2. That is why we should always advocate for early detection screenings. As we say, screenings save lives. The earlier cancer is found, the higher the chances are surviving and beating cancer. I would like to thank everyone for the continuous support. And for more information on cancer in Guam, you can call us at 671-735-0129. And thank you, everyone.
Thank you, Naomi. I now want to give the floor to Dr. Pichi Piana Pacheco, board certified radiologist from the Guam Radiology Consultants.
Good morning, everyone. Good morning. I'm honored to be here today as we join together to recognize October as Breast Cancer Awareness Month, an important time for us to focus on the health and lives of women everywhere, especially in our island. Breast cancer remains one of the most common cancers among women, with 1 in 8 women diagnosed in the United States in their lifetime. But the good news is, when detected early, it is highly treatable. The 5-year survival rate for women diagnosed with early stage breast cancer is around 99%. This is why breast cancer screening is such a vital tool in saving lives. And as a radiologist, I see this firsthand. Mammograms remain the gold standard for screening. Studies show that annual screening mammograms starting at 40 years old reduces the risk of dying from breast cancer by 40%. They allow us to detect cancers even before they can be felt, catching them at an early stage when treatment can be more effective. However, we also know that mammograms alone may not always tell the full story, especially for women with dense breast tissue or those at high risk. That's where supplemental screening comes in. Ultrasound and MRI can help us identify abnormalities that mammograms might miss, providing a clearer picture and leading to earlier diagnoses. Our message today is simple. Early detection through screening can save lives. If you are a woman who is 25 years old or older, please ask your healthcare provider for a breast cancer risk assessment to determine the screening options that are right for you. For average risk women, annual screening mammograms starting at 40 years old is recommended, while for high-risk patients, earlier screening might be necessary. With routine mammograms and the support of ultrasound or MRI when needed, we can catch cancer early when treatment is most effective. Together, we can reduce the impact of breast cancer and give more women the chance for long, healthy lives. Thank you to the offices of the Governor and Lieutenant Governor, the honorable members of the legislature, Guam Public Health and Social Services, GBC CEDP program, Guam Cancer Research and Guam Cancer Registry, our local healthcare providers, breast cancer survivors and families, and all those who support this life-saving mission. Let's work together to spread the word, encourage the women in our lives to get screened, and make early detection a priority for ourselves, our families, and our community. Si Diyos Masi.
Thank you, Dr. Pichi. I want to give the floor now to the Honorable Therese Interlahi, our Acting Lieutenant Governor of Guam.
Good morning, everyone. How's today? I really just want to extend my gratitude on behalf of the 37th Guam Legislature, all of the senators, to each of you who are doing the work for prevention, early detection, doing the work to actually care for those who have been diagnosed with cancer, helping them navigate, helping them get the services that they need, helping their families, and helping the caretakers. And I especially want to thank those of you who have been cancer patients or survivors of those who are cancer, who had breast cancer, and for the inspiration that you are to all of us. And I can't say this enough, or I don't even know the words to say, but I just want to say your strength and determination and your willingness to share that with us and share your fight with us and share how we can help you is really inspiring to all of us. And I think it brings us all together. And I want to just say thank you. So from the bottom of my heart, Jesus Masi to all.
Jesus Masi, Speaker. And now to our acting Governor of Guam, the Honorable Joshua F. Tenorio.
Thank you. Welcome this morning. If you're willing, I'd like to ask those that are cancer warriors and cancer survivors to raise your hand. How about those that are here today because of loved ones and friends who have been afflicted with breast cancer? Could you raise your hand? To me, clapping for you is a recognition that no matter what, the impact of that experience, that loss, has motivated you to continue to be active in this movement, to early detect and to battle and defeat, when we can, breast cancer. One of the data points that that she was sharing with us earlier that I thought was encouraging was the increasing percentage of breast cancer being caught at stage 0 and stage 1, which is very promising. But of course, one of the data points that we also heard is that there are highest rates in our Chamorro female population. That really is, in my mind, I'm wondering, what do we need to do for more action? Because one of the issues, of course, is access to healthcare. The ease of getting into a physician or somebody trained to be able to administer a screen, to be able to ensure that there's a timely response to a concern or even to an interest from any female that is wanting to be screened. And I think that part of this effort is educating. And a lot of this education can be focused for sure on the girls that are going to school, that are in the homes, that are also able to repeat the information to their moms and to their grandmas and to their aunts. It is a community mission that we all are nurturing and all are present here today to recognize. So this morning we're here to help with the public education, but also to recognize this battle that continues, that requires all of us to be active and for all of us to do our part in different ways, either through providing programming, assistance, resources like the elected leadership is here to do, bringing attention to being in the front line, trying to get our residents who don't have access or maybe are not familiar with access to healthcare to try and reach them. For those of us that can speak other languages, that can reach those that don't speak English or Chamorro or Tagalog, to try and spread that information with them. But also those that are providing that humanitarian and loving, friendly support to women who are going through a process of discovering and perhaps seeing a real threat that's occurring to them, their personal life. Remember, women are our mothers. They are responsible for uplifting our families. Children depend on their moms. They depend on their dads, but children come from the mom. And the moms have this responsibility, and many of them have that responsibility and have to go through the unraveling of their health situation, the truth that they're starting to experience. And many people in this room are really providing some essential support and letting them know all the things that they can do to access some support and help. But also for those cancer warriors who have defeated cancer, their willingness to spread the word and to turn around and to move into the community, into their families, and help others maybe avoid their path or maybe be able to identify and recognize it much earlier than they had. And for others that are looking and seeing people that maybe are having a big struggle in their life right now, it does take a lot to be a supporter. Many people have become caregivers, and caregiving is a very, very difficult thing too. And so that's part of this community, different aspects. We have people that are willing to activate themselves and go out and provide the kind of support. And for that, I want to say thank you. This is an overwhelming number of people. This is one of the most highest attended proclamations, which shows how very important and relevant this topic is to all of us, the people of Guam. So congratulations for your activism. We will continue to work and fight alongside of everybody. And let's celebrate the work that we're doing to spread the word, to push back on breast cancer, and to remember the collective work of everybody that is doing their part here in the room. Thank you very much.
Thank you, Acting Governor. Before I proceed to the reading of the proclamation, I do want to acknowledge the presence of GEC Executive Director Maria Peñalina, who is also a cancer champion. Also a very busy woman because we only see her on TV now. She's doing reports and updates on the election. I now want to give the floor to Ms. May Blas, Chairwoman of the Breast Friend Forever Breast Cancer Survivor Group, for the reading of the proclamation.
Thank you and welcome everyone. Proclamation number 2024-94. Proclamation of the Governor proclaiming October 2024 as Breast Cancer Awareness Month. Whereas every October, our island observes Breast Cancer Awareness Month along with the rest of the country to raise awareness about breast cancer, promote early detection through routine screening, and support those battling the disease. Whereas our island is not immune to this disease. On average, 66 women are diagnosed with invasive breast cancer each year on Guam, with 35% of cases found in women under the age of 55 years old. According to local data, 62.5% of breast cancer cases are diagnosed in its early stages, while the remaining 37.5% are diagnosed in late and unknown stages. Whereas on Guam, an average of 7 women die from breast cancer every year. Whereas through collaboration among organizations such as the Department of Public Health and Social Services, the Guam Breast Cancer Early Detection Program, the Guam Comprehensive Cancer Control Program, and many others, Guam has made substantial strides in breast cancer treatment, detection, and awareness. Whereas many lives have been saved through early detection, regular checkups, and an increase in overall awareness through education outreach initiatives. And whereas this month, our administration stands with all breast cancer survivors and their families, pays tribute to those we have lost to the disease, and recognizes the dedicated advocates, researchers, and healthcare providers who work tirelessly to ensure that breast cancer continues to be a priority and all those battling the disease receive the necessary support.
Now, therefore, I, Joshua F. Tenorio, Aktumagetlahin, Guahan, Acting Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim October 2024 as Breast Cancer Awareness Month.
In witness whereof, I, Therese M. Tarahi, Acta Segundo Mega Hagan Guahan, Acting Lieutenant Governor of Guam, hereby, together with the Acta Mega Lahin Guahan, cause the Great Seal of Guam to be affixed in the capital city of Hagåtña on this 11th day of October in the year of our Lord, Anno Domini 2024.
Viva Breast Cancer Awareness Month.
This blessing this morning to our acting lieutenant governor and acting governor. I want to call all our stakeholders to the front for a group photo. I know there's a lot of us, but we can make it work. Again, thank you so much for your advocacy.
We should just turn around and you can get the
We could do that too. So our